Body fluids serve to transport gases, nutrients, and wastes and help generate the electrical activity needed to power body functions. The total body fluid is distributed mainly between two compartments, the extracellular fluid, ECF, at 20% and the intracellular fluid, ICF, at 40%. The extracellular fluid is divided into interstitial fluid, ISF, at 15% and intravascular fluid, IVF, or blood plasma, at 5%. Diffusion is the movement of charged or uncharged particles along a concentration gradient. All molecules and ions, including water and dissolved molecules, are in constant random motion. It is the motion of these particles, each colliding with one another, that supplies the energy for diffusion. Because there are more molecules in constant motion in a concentrated solution, particles move from an area of higher concentration to one of lower concentration. Osmosis is the movement of water across a semi-permeable membrane, one that is permeable to water but impermeable to most solutes. Water diffuses down its concentration gradient, moving from the side of the membrane with a lesser number of particles and greater concentration of water to the side with a greater number of particles and lesser concentration of water. As water moves across the semi-permeable membrane, it generates a pressure called osmotic pressure. Laboratory measurements of electrolytes in body fluids are expressed as a concentration or amount of solute in a given volume of fluid, such as milligrams per deciliter, mg/dl, milliequivalents per liter, milliequivalent/L, or millimoles per liter, mole/L. Edema is defined as palpable swelling produced by the expansion of the interstitial fluid volume, and it represents the presence of excess fluid in the body tissues. The physiologic mechanisms that contribute to edema formation include factors that increase the capillary filtration pressure, decrease the capillary colloidal osmotic pressure, increase capillary permeability, and produce obstruction to lymph flow. Some clinical causes of edema include increased capillary filtration pressure such as renal failure, heart failure, vasodilator drugs, venous obstruction, premenstrual sodium retention, and pregnancy. Decreased capillary colloidal osmotic pressure can result from loss of proteins in urine, loss of protein from denuded skin areas like burns or wounds, and the failure to produce proteins due to liver disease or serious protein or caloric malnutrition. Increased capillary permeability can be caused by inflammation, allergic reactions, toxins, bacterial infections, vitamin deficiency, especially vitamin C, and tissue injury or burns. Blockage of lymph flow can be due to cancer, infections, surgery, or congenital absence or abnormality of lymphatic vessels. Electrolytes are minerals in your blood and other body fluids that carry an electric charge. Intracellular volume is regulated by the large numbers of proteins and other inorganic solutes that cannot cross the cell's membrane, and solutes such as sodium, potassium, and glucose that selectively move between the ICF and ECF dependent upon concentration gradients and transport mechanisms. Sodium and water balance involve the amount of water and its effect on sodium concentration in the ECF, which serves to regulate the distribution of fluid between the ICF and the ECF compartments. Sodium enters the body through the gastrointestinal tract, with normal intake derived from dietary sources, as well as intravenous saline infusions and medications that contain sodium. Sodium leaves the body through the kidney, gastrointestinal tract, and skin, with most sodium losses occurring through the kidney. Two main physiologic mechanisms that assist in regulating body water are thirst, primarily a regulator of water intake, and antidiuretic hormone, ADH, a regulator of water output. Potassium plays crucial roles such as the maintenance of the osmotic integrity of cells, acid-base balance, contributing to the chemical reactions that transform carbohydrates into energy, converting glucose into glycogen, converting amino acids to proteins, conducting nerve impulses, and the excitability of skeletal, cardiac, and smooth muscle. Potassium levels are influenced by dietary intake and elimination by the kidney. A transcellular shift can produce a redistribution of potassium between the ECF and ICF compartments, resulting in increased or decreased blood levels. Hypokalemia represents a serum potassium level below 3.5 milliequivalent/L and can result from inadequate intake, excessive losses, or redistribution between the ICF and ECF compartments. The manifestations of potassium deficit include alterations in renal, skeletal muscle, gastrointestinal, and cardiovascular function. Hyperkalemia represents an increase in serum potassium in excess of 5.0 milliequivalent/L and is rare in healthy persons because the body is effective in preventing excess potassium accumulation in the ECF. Major causes of potassium excess include decreased renal elimination of potassium, excessively rapid intravenous administration of potassium, and a transcellular shift of potassium out of the cell to the ECF compartment. The most serious effect of hyperkalemia is cardiac arrest.